I'm going to be talking about how to describe simple meniscal tears. And by simple meniscal tears, I mean tears that we see as a single line running through the meniscus. Tears which have multiple lines or where there are fragments displaced are called complex tears, and I'll talk about these in a separate video. The commonest simple tear that we see is the horizontal tear, so called because the line through the meniscus is running in the horizontal plane. In addition to describing its characteristic, you can also describe where it is within the meniscus. The meniscus is divided into anterior, middle and posterior parts, but also into three zones. The internal zone is zone 1, the middle zone is zone 2, and the periphery of the meniscus is zone 3. In this case, the horizontal tear is extending into zone 1, but is not completely penetrating the periphery of the meniscus. When these tears do penetrate the periphery, they can be associated with meniscal cysts. This is a common tear pattern in older patients and is not always symptomatic. This is the second type of simple tear, and this is a longitudinal tear. And here we can see that the line is running perpendicular to the horizontal plane. This tear type is very commonly seen in the periphery or zone 1 of the meniscus, often referred to as the red zone because there is a blood supply in this part of the meniscus. This tear pattern is frequently associated with anterior cruciate ligament rupture. We can see that this patient does have microfracture, so it's not surprising when we scroll to the center of the joint, we see that the anterior cruciate ligament is ruptured. Third tear type runs in and out of the plane of your screen, and this is the radial tear. And this patient has a radial tear in the lateral meniscus. Radial tears occur in two main locations. The first is this location, usually in the center or close to the center of the meniscal body. In the sagittal image, we see a small, well-defined defect in the meniscus. This is sometimes referred to as a cleft. With this location, if we go to the coronal image, we see that rather than a cleft, we see an area of the meniscus where the normal black signal has been replaced by fluid. And this is sometimes referred to as a ghost sign. So a radial tear is associated with a cleft in one plane and a ghost in the other plane. The other location for this type of tear is near the posterior root of the meniscus. Here are the two normal meniscal roots. Here you can see the meniscus coming down and then inserting by fibrous attachments to the tibial plateau. If we look at this patient here, we can see that there is a cleft where the meniscus normally attaches to the meniscal root. Because its attachment is disrupted, it's not surprising to see that the meniscus also springs out and becomes partially extruded, where it sticks out from the normal confines of the compartment. And often this meniscal extrusion is the first sign that you see in patients who have posterior root tears. So we have a cleft sign in the coronal plane with this location of the tear. And if we look in the sagittal plane, it's not surprising that we see the ghost sign here in this plane. We can see that the meniscus is normal to here, and as we scroll centrally, it disappears, giving us this ghost sign. So there are three descriptions: horizontal, longitudinal, and radial. Horizontal tears, commonly asymptomatic. Longitudinal tears, frequently associated with ACL rupture in the red zone and can thus heal. And radial tears, which we've seen in two types, in the central body and near the posterior root. These radial tears, particularly the ones in the central body, are often not uncommonly associated with meniscal cysts, and we can see an example of that in this patient.